Looking at the heart model, I want to first go over the coronary blood supply, the coronary arteries and veins. The right coronary artery exits on the right side of the aorta and moves along the base almost of the right atrium. The first branch which we want to know about is the marginal artery, supplying the lower part of the right ventricle. This area is also drained by the small cardiac vein, who then returns the blood parallel to the right coronary artery, going both towards the posterior side. We will look at this a little bit. Right now we stay on the anterior side, and I want to point out a small area here, which is our left coronary vein, coronary artery, which is larger, but it exits from the aorta and moves behind the pulmonary trunk, and that's why we can only see a very small fraction. The left coronary artery is branching into the circumflex artery along the outline of the left ventricle and the left atrium. The other branch of the left coronary artery is the anterior interventricular artery, supplying the anterior portion of the heart, also of the left ventricle. This area is drained by the great cardiac vein, moving the blood backwards. If I follow now the right coronary artery towards the posterior side, we can see another large branch, which is the posterior interventricular artery, supplying the posterior area of the heart, and this area is drained by the middle cardiac vein. The middle cardiac vein drains into the coronary sinus. The coronary sinus also receives blood from all major cardiac veins, including the small cardiac vein and the great cardiac vein, and then will drain towards the right atrium. The inferior vena cava, visible here, is also drained into the right atrium. In addition, we have on this side our superior vena cava, who receives blood from the from the left brachiocephalic vein and the right brachiocephalic vein, going into the right atrium with the right auricle. You can see these like little extensions here in the side. If I open this, we can see the inferior vena cava, superior vena cava entrance, the inferior vena cava entrance, and not quite visible, so I have to pick it up a little bit to show you. Inside here we have the coronary sinus entering the right atrium. What you also can see actually under these conditions is here right in the middle, this little lighter whitish kind of blurb, and this is the
fossa ovalis, originating from the foramen ovalis, which was used in the fetus where the right atrium opened into the left atrium.
Another feature of the atrium is these smaller ridges called the pectinate muscle, visible a lot on this upper area here. From the right atrium, we will go through the AV valves into the right ventricle. The AV valve is the tricuspid valve, and you can see these finer attachments, these cords, as the cordon tendinae or tendinous cords. These are attached at the ventricular muscle via the papillary muscles. The papillary muscles attach the chordae tendineae. Then here on the sides we see other thicker ridges in the ventricle, or here on the outer ventricular wall. These are the trabecular carinae. The blood from the right ventricle will move out via the semilunar valves and going into the pulmonary trunk. That makes these the pulmonary semilunar valve. So the blood moves then into the pulmonary trunk, and then from there to the left pulmonary artery and to the right pulmonary artery towards the lung. From the lung, it comes back via the pulmonary veins into the left atrium, and here we also have the right pulmonary veins going also into the left atrium. The left atrium is connected, or allows the blood to go from the left atrium to the left ventricle via the AV valve this time specifically the bicuspid valve or also mitral valve, again connected via chordae tendineae or tendinous cords to papillary muscles within the ventricular chamber. From the left ventricle now, the blood will enter via the aortic semilunar valve, the aorta. And as we saw already earlier, the aorta is divided into the ascending aorta, the aortic arch, towards the descending aorta. Blood vessels branching off this area are the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. Another feature I have not pointed out is here the ligamentum arteriosum, which is another remnant from the fetus, where the fetus had the ductus arteriosus, a direct opening from the pulmonary trunk to the aorta at the time while the lungs didn't need the blood supply because they were still collapsed inside. In the middle where we saw the anterior interventricular artery going, you can see we can have the interventricular septum. These white lines you can see here on the inner areas of the ventricles, right and left, are the Purkinje fibers, where the bundle branches are visible on the inside of the interventricular septum where they travel. And talking about the conduction system a second, we also can see here our AV node marked as a small number inside the heart. And as you know, the heart itself, the apex has a little left pointing towards your hip. Down here we have the apex of the heart, and referring to it as the base of the heart is where all arteries and veins enter and exit the heart.